Hello class, and welcome to your Chapter 17 lecture, where today we're going to be discussing drug abuse prevention. So the learning objectives for this lesson are that by the end, you should be able to list the 10 most prominent factors influencing individuals with regard to alcohol and other drug use, to identify and briefly explain the 3 major types of drug prevention programs, describe the 5 types of drug users that have to be considered before implementing a drug prevention program, list the 5 levels of comprehensive prevention programs for drug use and abuse, identify the 3 family factors that can prevent initiation into drugs or extensive drug use, list the 4 prevention program models that are found within higher education, describe the main goals of the following large-scale drug prevention programs, including the Bacchus Network, DARE, and drug courts. And finally, to describe 2 alternative prevention strategies or agendas for replacing drug use. So by way of introduction, this particular graph here just shows many of the potential environmental factors that are involved in what influences alcohol and other drug use. So you'll see here in the center, you have the individual. Out from the individual, you have their personality traits. You also have genetics, and we know that genetics, we've learned, is one of those factors that can influence whether or not an individual is going to use drugs, as well as interpersonal and peer resistance skills. So can they say no to their peers? As well as their attitudes and beliefs. So if we come out to the next circle, we see here we have their parents. These are external factors that are now going to influence the individual. So these are your interpersonal and societal influences. So your peers, your community, personal situations that you're in, local law enforcement and how they respond to drug use and abuse, and even school policy. So where it has attitudes and beliefs within the individual circle, that can be one's individual attitudes and beliefs towards drug use. But when you come into then the interpersonal and societal influences, it can also be the community's attitudes and beliefs towards use, or your parents' attitudes and beliefs. And then our outer circle is going to be the environmental influences. So looking at the cost of alcohol and other drugs, how is alcohol marketed? We've learned that colleges and different organizations have attempted to stop the marketing of alcohol on college campuses, since most of those individuals are not of the drinking age. How is alcohol and drug use portrayed on television, in the media, in movies, in music? What is the minimum age for purchasing alcohol? And then also including in that federal laws that concern alcohol and illegal drug use. So how serious are the problems of substance use disorders? So substance use disorders occur when recurrent use of alcohol or other drugs cause clinically significant impairments. So this includes health problems, disabilities, and a general failure to meet major responsibilities, whether it's at work, school, or at home. Substance use is also more common among adolescents and adults who have a mental illness or a severe mental illness. And in 2018, there were approximately 20 million people who were over the age of 12 that had a substance use related disorder, including alcohol or illicit drug use, in the past year. In 2018, similarly, there were 21 million people over the age of 12 who needed substance use treatment, but may not have gotten it. So youth and adults who have past year major depressive episodes are actually more likely to smoke cigarettes, binge drink, and even use illicit drugs. And among the different substance use disorders, the most common is marijuana. So it's important to understand the critical importance of having early substance abuse prevention in early childhood. So when we looked at that graph just a few slides ago, in the center we have the individual, and you see all of the different factors that can influence drug use. So we want to make sure that we are aiming these at early childhood prevention so that youth don't grow up trying drugs, that they don't become adults who are addicted to drugs. So drug prevention should be aimed at preventing or decreasing health, social, and personal problems. Prevention in early childhood can also change that child's trajectory for their entire life course. So that's why it's so important to address that prevention so early on. There's also a few influences that can influence an individual's drug use, particularly looking at children. So you have some genetic factors that are going to include a person's abilities, their personality, their physical health, as well as their vulnerability to risk factors to have behavioral problems. So youth who have behavioral problems or who are involved in delinquency are also more likely to use drugs and alcohol. And then you have environmental or contextual factors. So their surrounding environments and where they're going to parties. Is their environment the community? What does the community say about drug use? So the next two slides are just a substance use risk assessment that parents of teenagers can use and take at drugfree.org. So the first slide shows questions that are asked of the child. So they'll ask things such as, is my child just not interested or connected with school? Because we know that being connected to those pro-social bonds are what is going to insulate a youth from engaging in drug use. Do they frequently get into trouble when they are at school? Would I classify them as a risk taker? Are they possibly under a great deal of stress? I know I had a youth on probation at one point, and it was because she had so much stress on her from her parents to be perfect in music, in her studies, in Girl Scouts, and she started taking drugs as a way to cope with that. Does my child get easily impatient when it's their turn and it's delayed, or when there's a reward they're supposed to get and that's delayed? And are they close friends with others who use drugs? But it also requires that the parent ask questions of themselves and of their family. So do I as a parent have trouble enforcing rules for my teenage child? Do I know who their close friends are? In our family, do we yell at one another and insult one another? Do I believe that it's okay for teenagers to use marijuana? We have some youth on probation who their parents are currently using. So we often get asked the question of, well, why are you telling me I can't smoke when my mom is the first person I smoked with, or my dad smokes every day in the house? Is there a history of addiction within our family of at least one of the teenager's biological parents? Asking the question, at least one of my teenage child's parents or current caregivers has seen a healthcare provider about mental health problems. So with someone who's caring for that child, do they have mental health issues themselves? Do I allow my child and their friends to drink at our home? We all know those kids in high school whose parents would let you have drinking parties. And has my teen seen a healthcare professional about one or more mental health or behavioral issues? Because that's going to put them at a higher risk. So this tool isn't necessarily to diagnose a child, but it is rather a tool for parents to use to see, is this something that I should maybe take my child to the doctor for and get them a true evaluation? So now we need to look at risk and protective factors that could possibly help those youth who the parents are concerned about. So risk factors are going to be those that make drug use more likely. So things include maternal smoking and drinking, coming from a chaotic home environment, particularly where those parents are abusing substances or the parents suffer from mental illnesses, ineffective parenting. So am I a helicopter parent? Am I overly physical with my child when they're in trouble? Or do I parent effectively and appropriately? Having a lack of parent-child attachments and a lack of nurture or a nurturing environment. Maybe the child is inappropriately shy or aggressive while they're in the classroom, or they're failing at school. They may also have affiliations with peers who are displaying deviant behaviors. So these are all things that are going to go into risk factors that are going to make one more likely to use drugs. Then we have protective factors. So these are the ones that are associated with a reduced potential for drug use. So these are things such as strong and positive family bonds, parental monitoring of a child's activities and peers, So a parent who knows who their kid is hanging out with and they know where their kid is. Having clear rules of conduct and consistently enforcing those rules with my child. Being involved in the child's life, so going to their sports games, attending their events. Success in school performance is also going to bond that student to school and insulate them from drug use or attempt to. And then having strong bonds to other places or other institutions, such as religious organizations, or say Boy Scouts, Girl Scouts. And finally, an adoption of conventional norms about drug use. So when you have values and beliefs that are anti-drug use, you're going to be more likely to not use drugs as someone who believes that drug use is okay. So again, we need to make sure that these drug prevention programs are going to enhance those protective factors while we're looking to reverse or reduce the risk factors. The potential impact of risk and protective factors both are going to change depending on the person's age, their gender, as well as their ethnicity and culture, and their neighborhood environment. While I'm going through this lecture, just keep thinking back to that initial slide with that chart on it, seeing how all these different factors are going to influence that individual in the center. So does my neighborhood environment promote drug use? Is there someone selling drugs right down the street on the corner every day that I pass? Do I live near Kensington, Philadelphia, where there's major drug use and it's rampant, and police have kind of shown that they're not going to do anything about it anymore because it's so prevalent? So what does my neighborhood environment tell me about drug use? Or do I come from the suburbs? Or do I live on a farm where maybe I don't see drugs like that? I don't even know what they are. And then early intervention with risk factors is going to have a much greater impact. So that's why we're talking about how critically important it is to use these prevention programs in early childhood. So what should prevention programs do? Well, we know we have 3 different categories of drug prevention programs. Your primary programs are aimed at non-users or those who are at risk for potentially using drugs or trying drugs. We have your secondary, which are uncovering potentially harmful substance use before the onset of overt symptoms or problems, or targeting those who are early on in their drug use. And then the tertiary programs are going to focus directly on interventions, and they're going to target those who are chemically dependent and who need actual drug treatment. So we have 3 different stages. So drug prevention programs should address all forms of drug abuse and the type of drug abuse problem that is local to that community. It should be tailored to the risks that are specific to that population or audience. Again, you want to look at, does the child come from the inner city? Are we looking to create a prevention program for those in the suburbs? What does the population look like? So here, continuing on to consider the audience and our approach to that audience. So there are 5 major types of drug users that drug prevention programs are going to have to recognize before they're going to assemble a program. So those are going to include early experimenters, non-problem drug users and recreational users, undetected committed or secret users, those who are problem users, and former users. So when we look at non-problem drug users, the program should focus on abuse of drugs while reinforcing that uncontrolled use can lead to abuse. So these are drug users who don't have necessarily an addiction or a problem with the drug use. So we just want to reinforce that once that use becomes uncontrolled, that's when you have the recipe for addiction to occur. For former users, for example, we're going to reinforce their decision to stop abusing. So you want to make sure that they don't relapse. We also want to consider, are we promoting total abstinence, or are we just promoting responsible use? Are we hoping that individuals don't use drugs at all? Or are we saying our audience right now is 21 to 25-year-olds, and there's no way we're going to get them to totally abstain, or all of them to totally abstain from drug use. So let's at least try and get them to use responsibly. So then when we look at the goals, when we're considering the audience and our approach, What are the goals of the educational prevention models? Well, we want to convey the message that society is inconsistent concerning drug use. So we know that there are some who believe marijuana should be legal, some who believe it shouldn't, right? So society itself is not coming to a conclusion on drug use. So we need to acknowledge that fact. We also need to convey that reasons for drug use are complex and that users vary widely. You also want to show youth that everyone is affected by their role models, such as those who are in their family or even their close social circles. So who your friends are matters, who your parents are matters, and who you look up to matters. It could even include famous people, those in the media, and famous musicians. And also acknowledging other influential role models that can affect attitudes toward drug use, as I just mentioned. So when we look at the prevention research, what are some of the key findings that have come out of this? Well, we found that abuse of alcohol, tobacco, and illicit drugs cost the United States more than $740 billion annually related to crime, lost work productivity, and healthcare. So addiction is a complex disease that is predicated by multiple factors. Remember, you can have co-occurring disorders. Addiction is a developmental disease that usually begins in childhood and adolescence. So that is why we want to target, I can't say it enough, early childhood prevention. Because if we can prevent a child or a person from even using drugs or abusing drugs, we'll say, then we can prevent the need for treatment. We can prevent the need to have all of these lost costs in crime and lost productivity. So prevention and early intervention are going to work the best. We also want to show that any positive lifestyle activity can actually act as an alternative to a person participating in drug-using subcultures. So we'll talk about this at the end of the presentation, but you don't want to simply get an individual to just stop using the drug. We want to find them a pro-social positive activity that they can do in place of that drug that may give them some of the similar feelings, things such as working out, meditation, but where they're going to be positively impacting their body and their mental health. We also found that personal and skills training should be carefully based on known cognitive and behavioral change factors to make a difference. So we want to change their cognition, but also their behavior, so the way they think about drug use and then the way that they actually act on that. So we have a few different types of prevention programs. So the first we're going to cover are comprehensive prevention programs. So these are society-wide prevention, and they meet the addict on their own level. So this is the harm reduction model specifically. The harm reduction model is going to focus on understanding that excessive behaviors occur along a continuum of risk, ranging from minimal to extreme, right? So you have someone who totally abstains from drug use. You may have a moderate drinker, a binge drinker, someone who smokes crystal meth, and then someone who's injecting crystal meth. So you have this wide continuum of risky behaviors, and we acknowledge that in the harm reduction model because changing addictive behavior is a stepwise process. So you simply want to make steps in the right direction. So any progress is viewed as positive. And sobriety is not for everyone. So if the individual is either unwilling or unable to change their addictive behavior, then we shouldn't be denying them services solely because of that. Rather, we want to make attempts to reduce the harm that they're causing to themselves and that their habits cause. So the Harm Reduction Coalition was actually founded in 1993 by a working group of needle exchange providers, advocates, and drug users that set forth principles that they considered critical to success of harm reduction programs. So this coalition seeks to reduce the harms of drug policies that are dependent on the overemphasis of interdiction as well as total prohibition. They also seek to protect youth from the various dangers of drug use. They like to advocate for lessening the harms of drugs through both education, prevention, as well as treatment. And they seek to restore basic human dignity. So again, sobriety isn't for everyone. So if the person is not able to completely quit using, but say we have a female who is selling her body on the streets to make money to buy her heroin. So for her, she's not able to stop using that heroin yet. She's not ready. But what we can do is we can help get her a job. So now she has a job to pay for her drug use. So she's no longer selling her body on the streets. She's now protecting herself against sexually transmitted diseases, potential physical abuse, and domestic violence. We can protect her or reduce the harms to that individual while improving and making positive progress in the right step, in the right direction. We then have community-based drug prevention programs. So the primary goal of these is going to be to provide coordinated programs among numerous agencies and organizations. So this can include public awareness campaigns and political action, as well as attention to strengthening or changing the legal and social environment. And they're most effective when they respond to the needs of the community, when they involve all relevant sectors. So you want to have those from law enforcement, juvenile justice, education, mental health providers, etc. And when they're based on evidence, so evidence that they work, and they incorporate strong monitoring and evaluation components. So not only do we want to know that this works, we want to continue to collect data and make sure that this program is still working for this community that we've placed it in. So we should put in place prevention boards that are going to oversee the planning and implementation. And they should include representatives from all of those various agencies. The Community Anti-Drug Coalitions of America is an example. This was created in 1992. So this actually represents over 5,000 community coalitions with members in every state and territory and over 30 countries. So they provide core services such as training and technical assistance, research and evaluation, public policy and advocacy. They also have special events and conferences and international programs to help promote community-based drug prevention programs. So they emphasize the power of the community to prevent substance abuse through collaborative community efforts. And you can see how this prevention strategy or method would play into that initial diagram we saw of those environmental factors. They also believe that prevention of use and misuse before it starts is most effective. As I've said before, early intervention and prevention is best. We then have school-based drug prevention programs. So in the late 1800s, most states required that the harmful effects of drugs actually be taught in schools. And scare tactics and fear-based approaches were being used, and they're generally not effective. So most students who are getting these programs have already tried drugs, and they've only experienced the positive effects. So these programs relied on the negative effects or scaring youth into thinking that drug use was going to have all of these issues and it was going to lead them down this terrible path. But because that's not what happened when they used the drug, they're seen as exaggerations, or they simply just don't believe the person presenting the material and they think that they're lying. So they're not helpful in preventing drug use. Rather, we should be focusing on life skills, interpersonal skills, and interactive designs. So for life skills, these are things such as your personal, social, resistance, and communication skills. Students should be given information about the short-term effects of drugs because they can't and typically don't look at long-term. Should address interpersonal skills to handle different situations that they may come into where drugs are present. And we want to make sure that we're fostering positive behavior, achievement, whether it's in school, sports, music, academic motivation, and bonding them to those schools, as I've said before. So two of the programs, which we've covered the Atlas program before, but also the Athena program, they've actually been adopted by schools in 29 states as well as Puerto Rico and have been assessed as an exemplary prevention program. We also then have enforcement-based policies, which are grounded in the prohibitionist philosophy and are going to be less effective than curriculum-based drug prevention programs. So the enforcement-based are policies such as anti-smoking policies, your zero tolerance, drug searches in schools. So the Drug Free Schools and Communities Act, for example, that was enacted in 1987. Whereas when you use curriculum-based prevention programs, these are topics that are going to be specific to their audience, whether it's elementary, middle, high, or college age. And they're based within the curriculum of the school, and they're focused on that particular age group. For example, elementary school would be taught things such as the difference between drugs and poisons. They may be taught the different reasons that a person would take a drug. That can include medications for illnesses. And they're going to learn how drugs affect the body, basically, not too in depth. Then when they get to middle and high school, we're going to teach those students how to say no to peer pressure, because we're going to teach them that these drugs can affect their body physiologically and psychologically. So we want to improve those skills and those life skills and those interpersonal skills so they can say no to the peer pressure. And hopefully they will be more likely to say no because they now understand how it's going to affect their body. We also want to teach them about the consequences of breaking various drug laws, because some students and young people will say that they honestly just didn't know. They didn't know that they could get arrested for that. And then for college age, we want to teach responsible use of medication. So we've learned that some students will be prescribed Adderall, and they may sell this on college campuses. So responsible use of their own medication, not to sell it. Legal versus illegal drugs, looking at the effects of driving while drunk or impaired, and generally talking about addiction to drugs and alcohol. What are some of those risk factors? What are some things that you should look for, not only in yourself, but maybe in your friends? We then move on to family-based prevention programs. So protective family factors can actually moderate the effects of risk factors. So some primary family risk factors that are going to predispose a youth to finding drugs attractive are going to be things such as a chaotic home environment, ineffective parenting, whether it's too harsh or too soft, and a lack of mutual attachments to parents and nurturing. While when we look at the protective factors, these are things such as parent conventionality, so having conventional parents, maternal adjustment, and having a strong parent-child attachment. So when we look at these different factors here, this is what should be included in family-based prevention programs. So parent-child interaction strategies, teaching the parent to take on an active role, improving communication among the children and their parents, teaching child management practices, as well as family management skills. So some of the various principles are reaching families of children at every stage of their development, so focusing on K through 12, training parents in behavioral skills so that they can behave appropriately and not only teach their children, but show through example, as well as provide access to counseling services for families that are at risk. So we've discussed harm reduction strategies before, but this is specifically an individual-based drug prevention. So looking at harm reduction psychotherapy. So it's a therapeutic framework for users who cannot abstain. Remember, in the harm reduction philosophy or principles, it's okay if a user cannot completely abstain from use. We're going to work on a positive stepwise process to just improve and reduce the harm. So it's aimed at reducing those negative consequences that are associated with drug use by helping them simply reduce their use and gain control over their drug abusive behaviors. They also emphasize collaboration, respect, and self-determination, because if an individual does not want to change internally, they're most likely not going to, or they're not going to stick with it. So then looking at drug prevention in higher education, well, the first question you have to ask yourself is, why do we care? So there are roughly 300,000 college students that will die of alcohol-related causes. 159,000 first-year college students will drop out of school the following year because of alcohol or drug-related reasons. Moreover, 1/3 of college students have missed either one or more classes because of alcohol or drug use. And even just one night of heavy drinking can impair a person's ability to think abstractly for up to 30 days. And I personally learned that from this text, and I found that very interesting. So, binge drinking is not only not helpful for your body physically, but mentally it's going to impair you for up to a month. So we have 5 actual different prevention programs here. So the first is the information only or awareness model. So this is based solely on teaching about drug information, the effects of using different types of drugs. So this believes that if people are given extensive information about the harmful effects of drugs, then it will change their attitudes about drug use and abuse. The issue with this model is that it assumes that people are rational thinking, and even as an adult, we're not always rational thinkers. Our next model is the attitude changing or effective education model. So the goal of this one is to change the attitudes and the role of self-esteem in drug use and abuse. So focusing on strengthening a person's self-image and their self-esteem. This model assumes that people use drugs because they have low self-esteem. But attitudes are often resistant to change, and attitudes can fluctuate based on the environment that a person is in. So that has to be taken into account. I may say, no, I absolutely don't believe in binge drinking, but then when I get to a party, my environment has changed. I now have peers who are binge drinking, and I'm just going to partake because my environment has changed and my attitude has changed. Then we have the social influences model, which is how to use resistant skills when drugs are readily available within their environment. This model assumes that substance abuse results from multiple influences and emphasizes peer resistance and inoculation techniques. So this model is going to work best when it's aimed at the junior high school level. It is unfortunately least successful or effective with alcohol, but this model is very effective when looking at marijuana and cigarettes. So again, if you use my party example earlier, the social influences model is not really effective when it comes to alcohol consumption, because if I'm at a party, I may not be so likely to have a cigarette or smoke marijuana because not everyone may be doing it. However, everyone is probably drinking. We then have the ecological or person in environment model, which looks at how changes in a student's social environment can affect their attitudes about drugs and drug use. So this is the newest model, and it does have multiple components to it. It is designed to address individuals and policies, practices, and social norms that affect students on a campus. So it's based on the notion that an individual and their behavior cannot be fully understood without considering their whole environment. And it stresses that changes in that environment can change people's primary focus on causes from their social environment. And lastly, we have the social ecological model, which considers the complex interplay among individuals, their relationships, their communities, and societal factors. So it emphasizes multiple interacting factors that put a person at risk for experiencing and becoming addicted to drugs. So we can look at now examples of the larger scale drug prevention programs now that we've covered a couple different types. So the first is the Bacchus Network or initiatives. So Bacchus stands for Boosting Alcohol Consciousness Concerning the Health of University Students. And it actually began in 1975 as a national student organization with a goal to prevent alcohol abuse. So the national initiatives of NASPA, which NASPA stands for the National Association of Student Personnel Administrators. So this organization, Bacchus, merged with NASPA, and this is the leading association now for the advancement, health, and sustainability of student affairs profession. They have a goal to address student health overall and safety issues, while promoting student leadership on healthy and safe lifestyle decisions. We also have post-secondary drug prevention programs. These are going to be peer-based efforts that are going to speak the language of the students and work to change the cultural tone on campus. So they infuse these programs within the curriculums in, say, writing classes, gender issue classes, which allows for an open discussion of drugs as just part of the normal education process. So it's not looked at as, oh, I'm taking a drug class to learn about drugs. It's just infused within the curriculum. Improvisational theater groups have also been recommended as a lively and stimulating way to show the effects of drug use and abuse. And they've also recommended publicizing results from surveys that students have taken, showing how much they actually do overestimate the drug use of their peers. Because once they realize that, oh, my peers are not actually using drugs as much as I thought they were, they don't feel the need to keep up with that unrealistic norm that they've set in their head now. Also offering alternative alcohol-free events on campus, and again, removing those alcohol advertisements from campuses. So DISCUS, which is the Distilled Spirits Council of the US, actually calls for advertisements not to be placed where the majority of the audience is reasonably expected to be below the drinking age, which simply makes sense. Are you going to put a cigarette vending machine in a high school? No, this is in the 1970s. We're not going to do that now. So where most of your audience is not at the age where they can legally purchase or consume that drug. And then we have DARE, our time-old DARE program, which was established in 1983. It still currently operates in 74% of school districts across the United States and in foreign countries. The program not only addresses drugs, though, it addresses internet safety now, violence, bullying, and other high-risk circumstances that students may find themselves in. So the goal for these programs now for DARE is to improve students' views of themselves and increase their sense of personal responsibility. So it is not effective at reducing drug use, but it is effective in these other areas, which is why, and it's just such a time-old program of why it's still used. We then have drug courts. So as of 2020, there were over 3,000 of them operating. These are for those with a substance use disorder. So it's going to target specifically those high-risk offenders who have a more severe antisocial backgrounds or a poorer prognosis for success in traditional types of treatment. So drug courts give the person an opportunity to enter long-term treatment and agree to court supervision rather than receiving a jail sentence. They're multidisciplinary, so you're including in this judges, prosecutors, defense, the offender, healthcare programs, treatment programs. You have everyone working as a team. They're typically for a minimum of 1 year and consist of 3 separate treatment phases. The first phase is detoxing. So this is going to remove the physical dependence from the person. They then move into the next treatment phase of stabilization, where they're going to treat the psychological craving that they have. And aftercare is now where we're going to help that person get into an educational program or a job and help them remain drug-free. These programs are very effective and have shown lower rearrest rates and reduced crime 35% more than other court options, so your traditional court options. They are more cost-effective. There's improvement shown in their family relationships. We have higher employment rates and annual income. And there's less use of illegal drugs and heavy use of alcohol for those who complete drug courts. So what are some problems we may have, though, with assessing how successful a drug prevention program is? Well, it can be a little tough to know specifically which prevention program it was that was effective, unless you're going to follow a same cohort that took that program throughout their life or throughout the next few years to see how effective it was. So the text says that prevention must be coordinated at different levels. So if it's going to be effective, we can't simply give prevention programs to early childhood. We have to make sure that we're continuing it and continuing to reinforce those ideas up through college. They should also be integrated into activities of the school, family, and community organizations. So future prevention programs must focus on education and collaboration. Personal autobiographical and social experiences of those who have already been through drug use should be included because it gives credibility to the program. It also helps to show they were successful. And we have these different components here. So you have education. Again, you have collaboration, policy, and research. So we should have research to advance policy and intervention efforts. We should also be educating the communities and policymakers, recognizing that substance abuse prevention is going to be intrinsically tied to other outcomes. Again, mental health, lots of co-occurring disorders. Academic success, you heard me say earlier in the lecture how important it was and how protective it can be for a student to have a strong bond to their school and to do well academically. Or it can be a risk factor if they're not attending school, if they're doing poorly, if they're not bonded to their social institution. And violence prevention. And finally, we need to have collaboration. This is collaboration between your healthcare providers, your education providers, and the judicial systems if we're going to be successful, which is why personally I love the juvenile probation field, because we do collaborate with all of the different providers. So I'm able to see sort of how some of this comes to be and is successful with certain youth. So what are some other alternatives I said we would talk briefly about to using drugs? So it is suggested that people who use drugs have an innate need to alter their conscious state. So there's a couple alternatives to doing this. So if anyone is into physical fitness, I know I like lifting, for example, you can put yourself, even runners, you can put yourself in a different mental space when you're working out, when you're doing athletics, when you're dancing and exercising, or even hiking. You can have sensory alternatives, such as sky or scuba diving. So there you can get your thrill-seeking, you can, kind of quench your thrill seeker inside of you by doing something that's a positive activity, if it's done safely, of course, skydiving and scuba diving, or even sensory awareness training. We have emotional alternatives, so attending counseling, going to group therapies. Social alternatives. Maybe I'm going to get more involved in my community for positive change. I'm going to tutor youth. I'm going to volunteer at my local community center. And then you have spiritual or mystical considerations, such as meditation. So meditation is actually using the mind to control itself as well as the body. And it involves brainwaves activity that are centered on ponderous, contemplative, and reflective thought. So by meditating, you can actually decrease your oxygen consumption by up to 20% in just minutes, which leads to a decreased metabolic rate, a decrease in blood lactate, so slower heart rate, slower respiration. You can calm yourself and actually take yourself into a deeper self-awareness state, which some people have described getting that same feeling from drugs. So now we're trying to find a positive alternative. So in sum, there are 10 prominent factors that influence an individual's alcohol and drug use. The 10 most prominent factors influencing this include genetics, personality traits, attitudes and beliefs, interpersonal and peer-resistant skills, community, peers, school policy, local law enforcement, personal situations, and parents. I would suggest to you too, take a look at that graph from one of the first slides and kind of map out where these fall on that to help you remember them. There are 3 major types of drug prevention programs, including primary, which are aimed at either non-users or those who are at risk to use. Secondary, being new users before the negative effects of their drug use kick in. And then tertiary programs, which are focusing on those who are chemically dependent to the drug. There are 5 types of drug users that have to be considered before implementing a drug prevention program, such as your early experimenters, non-problem drug users and recreational users, undetected committed, or those who use in secret, problem users, and former users. So you need to know your audience. There are also 5 levels of comprehensive prevention programs, including the harm reduction model. We're not going for perfection in that model. Remember, we're just trying to reduce the harms and move in a positive direction. Community-based prevention programs, looking at the community's involvement in drug use and being able to prevent drug use. School-based, K through 12, looking at college programs. Those focusing on family and increasing the protective factors of families. And then individual-based drug prevention programs, such as the harm reduction psychotherapy. Parent conventionality, maternal adjustment, and strong parent-child attachments are family factors that can prevent initiation into drug use or extensive drug use. And then the prevention program models that are found within higher education, there are 5, including the information only or awareness model, the attitude change model or effective education model, social influences, ecological or person in environment, and social ecological model. The main goal of the Bacchus Network is going to be to address student health and safety issues while also promoting student leadership on healthy and safe lifestyle decisions. The main goal of DARE is to address drugs, internet safety, violence, bullying, and other high-risk circumstances. While the main goal of drug courts is to reduce drug use and recidivism while improving the lives of high-risk offenders who have severe antisocial backgrounds and substance use disorders where traditional treatment does not work. And finally, alternative prevention strategies for replacing drug use can include things such as physical, spiritual, sensory, emotional, and social. So that was your Chapter 17 lecture on drug prevention programs. As always, if anyone has any questions, please feel free to reach out. I hope everyone has a fabulous week.